Good morning. Am I audible? Good morning. Am I audible? आवाज येतोय का माझा?
Yes, ma'am.
Okay. So this is medicine lecture. So we had started with infectious diseases. And we are taking offline lectures. So we'll continue with the same lectures, infectious diseases. Can anyone tell me what you are seeing in image? What you are able to see in image? Anyone? काय दिसते इमेज मध्ये? Anyone? Yes, Saili, Vaishnavi.
Ma'am, office the tonus position.
Yes. In which disease it is? कोणत्या डिसीज मध्ये दिसते ऑफिस टोनस पोझिशन?
टिटॅनस.
टिटॅनस. अजून एनी टाइप ऑफ पॉइझनिंग? कोणत्या पॉइझन मध्ये दिसते का? नक्सोमिका ड्रग कव्हर करतो, पण नक्सोमिकाचं जे कंटेंट आहे स्ट्रिचनिन ऍक्टिव्ह प्रिन्सिपल, जर ते स्ट्रिचनिन क्रूड फॉर्म मध्ये घेतलं तर त्या क्रूड फॉर्मचा स्ट्रिचनिनचा पॉइझनस इफेक्ट सेम असा असतो, लाईक टिटॅनस, ऑफिस टोनस पोझिशन. So today we'll start with tetanus. That is tetanus. So tetanus is an acute disease which is induced by the exotoxin. Which exotoxin? It is exotoxin of Clostridium tetani. And it is clinically characterized by muscular rigidity which persists throughout illness. And it is punctuated by painful paroxysmal spasms of voluntary muscles. especially the muscles of masseters. The spasm of masseter, we can call it as trismus or lockjaw. Then spasm of facial muscles, we call it as rhesus sardonicus. And the muscles of back and neck, it is we called opisthotonus. And also there is a spasm of lower limbs and abdomen. What is tetanus? Tetanus is an acute disease induced by exotoxin of Clostridium tetani. What it is? It is an acute disease induced by exotoxin of Clostridium tetani. And it is clinically characterized by muscular rigidity which persists throughout the illness, punctuated by painful paroxysmal spasm of voluntary muscles. Painful paroxysmal spasms of voluntary muscles, especially the muscles of masseters, facial muscles, muscles of back and neck, and those of lower limbs and abdomen. The mortality is very high. It varies from 40 to 80%. Mortality means death rate. Death rate due to tetanus. So this mortality is very high. It varies from 40 to 80%. What is the problem statement? That is epidemiology. So in the world, tetanus is now comparatively rare disease in the developed countries. The neonatal tetanus is a killer disease, second only to measles. The first killer disease is measles and second one is neonatal tetanus. Even with the treatment, the case fatality rate can be as high as 80 to 90%. During 2012, a total of 10,392 cases of tetanus and 4,650 cases of neonatal tetanus were reported to the WHO worldwide. So in developed countries, it is rare, but still in developing countries, its fatality rate is very high. Like it is 80 to 90%. And the census which we carry after every 10 years, that is last census is in 2011. It is not conducted in 2021 due to lockdown. So we have the records of 2011 only. So during 2012, a total of 10,392 cases of tetanus and 4,650 cases of neonatal tetanus were reported to the WHO worldwide. Then in India, so tetanus is an important endemic infection in India. The behaviors such as hand washing, delivery practices, traditional birth customs, and interest in immunization are all important factors affecting the disease incidence. Incidence is new cases of tetanus. So why it is common in India? Because the behaviors such as hand washing, delivery practices, traditional birth customs, and interest in immunization are all important factors affecting the disease incidence. So in 2013, about 528 cases of neonatal tetanus were reported in India compared to the 11,000 in 1989. It is reduced due to vaccination, tetanus vaccination. So it is reduced from 11,000 in 1989 to 528 cases in 2013. So what are the epidemiological determinants of tetanus? So first one is agent factor, that is agent, responsible organism. Agent is responsible organism. So it is Clostridium tetani. Clostridium tetani is a gram-positive anaerobic spore-bearing organism. Anaerobic means it can survive without oxygen. So Clostridium tetani is a gram-positive bacteria, anaerobic and spore-bearing organism. You can see in the image Clostridium tetani. It is the microscopic picture of Clostridium tetani. The spores are terminal and give the organism as a drumstick appearance. You can see in the image the drumstick appearance of Clostridium tetani. The spores are highly resistant to the number of injurious agents, like including boiling, phenol, cresol, and autoclaving for 15 minutes at 120 degrees centigrade. Means even with boiling, treating it with phenol, cresol, or autoclaving, it is not able to destroy. So these spores are very, very highly resistant. They germinate under the anaerobic conditions and produces a potent exotoxin. The exotoxin is tetanospasmin. The spores are best destroyed by the steam under the pressure at 120 degrees Celsius for 20 minutes or by the gamma irradiation. So how these spores are destroyed or how Clostridium tetani can be destroyed? It can be destroyed by the steam under the pressure at 120 degrees Celsius for 20 minutes or by the gamma irradiation. Then what is the reservoir of infection? The natural habitat of organism is soil and dust. What is the natural habitat of Clostridium tetani? It is soil and dust. The bacilli are found in the intestine of many herbivorous animals. Example, cattle, horse, goat, sheep, and these organisms are excreted in their feces. These spores survive for years in nature. The bacilli may be found frequently in the intestine of man without causing ill effects. So what is the reservoir of infection? The natural habitat of organism is soil and dust. The bacilli found in the intestine of many herbivorous animals, example cattle, horse, goat, sheep, and are excreted in their feces. These spores survive for years in nature. The bacilli may be found frequently in the intestine of man without causing ill effects. Then exotoxins. Tetanus bacilli produce a soluble exotoxin. And the lethal dose means harmful dose for 70 kg man is about 0.1 milligram. Lethal dose means harmful dose or toxic dose. The lethal dose for 70 kg man is about 0.1 milligram. The toxin acts on 4 areas of nervous system. The motor end plates in skeletal system, spinal cord, brain, and the sympathetic system. So what is the principal action of this exotoxin? The principal action of exotoxin is to block the inhibition of spinal reflexes. As it blocks the inhibition of spinal reflexes, it leads to the spasms. It leads to the convulsions. The period of communicability is none. It is not transmitted from person to person. Remember, it is not spreaded from person to person. We'll revise exotoxin. Tetanus bacilli produce a soluble exotoxin. What is the name? Tetanosporin. The lethal dose for a 70 kg man is about 0.1 milligram. The toxin acts on 4 areas of nervous system, that is motor end plates in skeletal system, spinal cord, brain, and the sympathetic system. Its principal action is to block inhibition of spinal reflexes. Then period of communicability, it is none. It is not transmitted from person to person. Then host factors. Commonly, tetanus is a disease of active age, that is 5 to 40 years. This period predisposes to all kinds of trauma, and therefore the risk of acquiring the disease is pretty high. Tetanus occurring in newborn is known as neonatal tetanus. Infants typically contract the disease at birth when delivered in non-aseptic conditions, especially when the umbilical cord is cut with unclean instruments or when the umbilical stump is dressed with ashes, soil, or cow dung. So commonly tetanus is the disease of active age, that is 5 to 40 years. This period, why 5 to 40 years? Because this period predisposes to all kinds of trauma, and therefore the risk of acquiring the disease is very high. The tetanus which occurs in newborns is known as neonatal tetanus. Infants typically contract the disease at birth. When delivered in non-aseptic conditions, especially when the umbilical cord is cut with unclean instruments or when the umbilical stump is dressed with ashes, soil, or cow dung. The next, sex. Although higher incidence is found in males, females are more exposed to the risk of tetanus, especially during delivery or abortion, which leads to puerperal tetanus. Its incidence is higher in males, but females are more exposed to the risk of tetanus, especially during delivery or abortion, which leads to the puerperal tetanus. Means tetanus in puerperal period. Puerperal period is the period after the delivery. It is of 45 days. males appear to be more sensitive to tetanus toxins than females, so that its incidence is high in males. Then occupation. Agricultural workers are at special risk because of their contact with soil. Because the reservoir is mainly soil. Then rural-urban differences. The incidence of tetanus is much lower in the urban area than in rural areas. Then immunity. No age is immune unless protected by previous immunization. So no age is immune for this tetanus unless they are protected by previous immunization. The immunity resulting from 2 injections of tetanus toxoid is highly effective and lasts for several years. As a general rule, patients who have recovered from tetanus must be actively immunized because the amounts of toxin responsible for the disease in man do not stimulate protective immunity like other diseases. What we say, if we have suffered from chickenpox, we get the protective immunity for lifetime. That will not again suffer from chickenpox. So in tetanus, it is not like this. The patient do not develop protective immunity for tetanus, even if they are suffered. So what is the general rule? The patients who have recovered from tetanus must be actively immunized regularly because the amount of toxin responsible for the disease in man do not stimulate protective immunity. What is the dose of that toxin? It is 0.1 milligram for 70 kg person. Immunity lasting for few weeks, that is less than 6 months, can be transferred to the baby if the mother is immunized during pregnancy. Immunity lasting for few weeks, which is less than 6 months, can be transferred to the baby if the mother is immunized during pregnancy. So tetanus is one disease in which herd immunity does not protect the individual because it cannot develop the protective immunity. So it is one disease in which herd immunity does not protect the individual. Then environmental and social factors. Tetanus is a positive environmental hazard. Its occurrence depends upon the man's physical and ecological surroundings. That is soil, agriculture, animal husbandry, and not on the presence or absence of infection in the population because it cannot be transferred from person to person. So tetanus is a positive environmental hazard. Its occurrence depends upon the man's physical and ecological surroundings. That is soil, agriculture, animal husbandry, and not on the presence or absence of infections in the population because it cannot be transferred from person to person. The environmental factors are compounded by the social factors such as unhygienic customs and habits. For example, application of dust or animal dung to the wounds. Then unhygienic delivery practices. Example, using unsterilized instruments for cutting the umbilical cord. Next one is ignorance of infection and lack of primary healthcare services. In the developed countries, in urbanization, industrialization, and mechanization of agricultural have interfered with normal process of distribution of Clostridium tetani. And due to that, there is a reduced morbidity rate. This is the reason why the incidence of tetanus is less in developed countries due to urbanization, industrialization, and mechanization of agriculture. Then what is the mode of transmission? So infection is acquired by contamination of wounds with tetanus spores. Infection is acquired by contamination of wounds with tetanus spores. The range of injuries and accidents which may lead to tetanus comprise a trivial pinprick, skin abrasion, puncture wounds, burns, human bites, animal bites and stings, unsterile surgery, intrauterine death, bowel surgery, dental extraction, injections, unsterile division of umbilical cord, compound fractures, chronic skin ulcers, eye infections, and gangrenous limbs. So the range of injuries is very high. That is, it can be trivial pinprick to gangrenous limbs. It can be skin abrasion, puncture wounds, animal bites, unsterile surgeries, injections, dental extractions, skin ulcers. So the range is very high. Then the sequence of events are introduction of spores, then germination and elaboration of exotoxin and binding to the receptor. What are the sequence of events? First, there is the introduction of spores of Clostridium tetani. Then there is a germination and elaboration of exotoxin and binding to the receptor. Then what is the incubation period? The incubation period is usually 6 to 10 days. What is incubation period? That is the entry of the organism in the human being to development of symptom. This period is called as incubation period. So incubation period is usually 6 to 10 days. However, it may be as short as 1 day or as long as several months. The long incubation is probably explained by the spores lying dormant in the wounds. Dormant means in inactive phase. Inactive. So spores lying in a dormant phase in the wounds. Then what are the types of tetanus? First is traumatic. So trauma is the major and important cause of tetanus. Sometimes tetanus may result from most trivial or even unnoticed wounds. Then puerperal tetanus. Tetanus follows abortion more frequently than a normal labor. A post-abortal uterus is a favorable site for germination of tetanus spores. So puerperal tetanus, this tetanus follows abortion more frequently than a normal labor. A post-abortal uterus is a favorable site for germination of tetanus spores. Then third type is autogenic. Here may be the rare portal of entry. Foreign bodies such as infected pencils, matches, beads may introduce the infection. So autogenic tetanus is a pediatric problem, but cases may occur in adult also. Then idiopathic tetanus. In these cases, there is no definite history of sustaining an injury. Some considered it to be the result of microscopic trauma, means which we cannot notice, microscopic trauma. Others hold the view that it is due to the absorption of tetanus toxin from the intestinal tract. And the third view is that tetanus spores may be inhaled and may start the infection. So idiopathic means cause is not known. Idiopathic. It can be the result of microscopic trauma, or it can be due to absorption of tetanus toxin from the intestinal tract, or the spores may be inhaled. So any reason. The next type is tetanus neonatal. So in many countries, neonatal tetanus kills about 85% of those affected. The common cause is infection of umbilical stump after the birth. The first symptom being seen about the 7th day. Therefore, tetanus is known as 8th day disease in Punjab. What it is called in Punjab? It is called as 8th day disease. Why? Because the first symptom is seen about the 7th day after the infection to umbilical stump. In any country where hygiene is poor, neonatal tetanus may be common. Meeting can end in less than 1 minute. So neonatal tetanus. So in many countries, neonatal tetanus kills about 85% of those which are affected. The common cause is infection of umbilical stump after the birth. And the first symptom being seen about the 7th day. Therefore, in Punjab, it is called as 8th day disease. 8व्या दिवसाचा disease म्हणतात. In many countries where hygiene is poor, neonatal tetanus may be common. Then complications of tetanus. Once the tetanus toxin bonds to nerve endings, it is impossible to remove. Complete recovery requires growth of new nerve endings and it takes several months. Fractures due to severe muscular spasms. Prolonged immobility by high doses sedatives leads to the permanent disability. Brain damage in infants. Respiratory failure is the most common cause of death. What are the complications? First of all, once the tetanus toxin bonds to the nerve endings, it is impossible to remove. Complete recovery requires growth of new nerve endings and it takes several months. Then fractures due to severe muscular spasms, prolonged immobility due to the high doses of sedatives, which leads to the permanent disability, brain damage in infants, respiratory failure is the most common cause of death. Then prevention. How to prevent tetanus? So first is active immunization. Tetanus is best prevented by active immunization with the tetanus toxoid. That is TT injection. Tetanus toxoid. This tetanus toxoid stimulates the production of protective antitoxins. The aim should be vaccinate the entire community and ensure a protective level of antitoxin, approximately 0.01 international unit per ml serum throughout the life. All persons should be immunized regardless of age. So prevention first is by active immunization. Tetanus is best prevented by active immunization with tetanus toxoids. It stimulates the production of protective antitoxins. The aim should be to vaccinate the entire community and ensure a protective level of antitoxin, approximately 0.01 international unit per ml serum throughout the life. All persons should be immunized regardless of their age. Then there are two preparations available for active immunization. First is combined vaccine, that is DPT. Full form of DPT, diphtheria, pertussis and tetanus. It is combined 3 vaccines, diphtheria, pertussis and tetanus. The next is monovalent vaccine. Monovalent vaccines, plain or fluid toxoid. Plain or fluid toxoid. And second is tetanus vaccine absorbed. It is called as PTAP or APT. Absorbed tetanus vaccine. combined vaccine. The tetanus vaccine is offered routinely to the infants in expanded immunization program. What is our national immunization program, which is launched in 1994 in combination with diphtheria vaccine and killed pertussis organism, Bordetella pertussis, as a DPT vaccine. In India, this DPT vaccine is prepared by Serum Institute, which is in Pune. Serum Institute. According to the National Immunization Schedule, the primary course of immunization consists of 3 doses of DPT at the interval of 4 to 8 weeks, starting at the 6 weeks of age, followed by the booster at 18 months of age, and the second booster at 5 years of age, and the third booster, that is only TT, after 10 years of age. So according to the National Immunization Schedule, the primary course of immunization consists of 3 doses of DPT and 1 dose of only TT. 3 doses are at the 6 weeks of age, 18 months of age, 6 years of age, and last one is at only TT is at 10 years of age. Then monovalent vaccines. Purified tetanus toxoid, which is absorbed, has largely supplanted plain toxoid because it stimulates a higher and longer lasting immunity which responds than plain toxoid. A primary course of immunization consists of 2 doses of tetanus toxoids absorbed, each dose 0.5 ml injected into the arm, given at the interval of 1 to 2 months. The longer the intervals between the 2 doses, the better is the immune response. The first booster dose, that is third in order, should be given at the year after the initial 2 doses. This purified tetanus toxoid should be stored between 4 and 10 degrees Celsius. So what is monovalent vaccine? It is the purified tetanus toxoid. It has largely supplanted plain toxoid because it stimulates a higher and longer lasting immunity response than the plain toxoid. A primary course of immunization consists of 2 doses of tetanus toxoid given at the interval of 1 to 2 months. Each dose contains 0.5 ml, which is injected into the arm. The longer the intervals between the 2 doses, the better is the immune response. And the first booster dose, that is third in order, should be given a year after the initial 2 doses. This purified tetanus toxoid should be stored between 4 and 10 degrees Celsius. Then second is passive immunization. Passive immunization is temporary protection against tetanus can be provided by an injection of human tetanus hyperimmunoglobulin, that is TIG or ATS. Temporary protection against tetanus can be provided by injection of human tetanus hyperimmunoglobulin. First is human tetanus hyperimmunoglobulin. It is the best prophylactic to use. The dose for all ages is 250 IU. It does not cause serum reaction. It gives a longer passive protection up to 30 days or more compared to 7 to 10 days for horse ATS. So human tetanus hyperimmunoglobulin, it is the best prophylactic to use. The dose for all ages is 250 international unit. It does not cause serum reaction and it gives longer passive protection up to 30 days as compared to the horse ATS. Second is ATS, that is equine. If human antitoxin is not available, equine antitoxin should be used. That is anti-tetanus serum. ATS, anti-tetanus serum. It is mainly made from the horse. The standard dose is 1500 international unit. It is injected subcutaneously after sensitivity testing. Here it can cause sensitivity. So it should be injected after sensitivity testing. ATS gives passive protection for about 7 to 10 days. Being a foreign protein, ATS is rapidly excreted from the body and there may be very little antibodies at the end of 2 weeks. So because of this drawback, ATS may not cover the tetanus incubation period in all cases. So if human antitoxin is not available, equine antitoxin, that is anti-tetanus serum, should be used. The standard dose is 1500 international unit injected subcutaneously after sensitivity testing. This ATS gives passive protection for about 7 to 10 days. Being a foreign protein, ATS is rapidly excreted from the body and there may be a very little antibodies at the end of 2 weeks. And because of this drawback, ATS may not cover the tetanus incubation period in all cases. So this horse ATS has some other disadvantages also. Like it causes sensitivity reaction in many people because it contains foreign proteins. Then a person receiving ATS for the first time may tolerate it well, but there is possibility that subsequent injections of horse serum may lead to the allergic reactions, varying in severity from rash to anaphylactic shock. Then another drawback of ATS is that it stimulates the formation of antibodies to it, and hence a person who has once received ATS tends to rapidly eliminate subsequent doses. It can cause the formation of antibodies against ATS. So as such, the value of second and subsequent doses of ATS becomes questionable. Then third one is active and passive immunization. Simultaneous active and passive immunization is widely carried out in non-immune persons. The patient is given 1500 units of ATS or 250 units of human immunoglobulins in one arm and 0.5 ml of absorbed tetanus toxoid into the other arm or in the gluteal region. So this should be followed 6 weeks later by another dose of 0.5 ml of tetanus toxoid and the third dose 1 year after. The purpose of antitoxin is for immediate temporary protection and the purpose of toxoid is long-lasting protection. So it is combined active and passive immunization. We can use both type of immunization at the same time. Then last one is antibiotics. A single intramuscular injection of 1.2 mega units of long-acting penicillin will provide a sustained concentration of drug for 3 to 4 weeks, which is sufficient to kill any vegetative forms of tetanus bacilli that may emerge from the sporulating stage. Penicillin has no effect on tetanus spores. It acts on vegetative forms of tetanus. For patients who are sensitive to penicillin, a 7-day course of erythromycin istolate 500 mg 6 hourly by mouth will kill the vegetative forms of Clostridium tetani, but not spores. The antibiotic should be given as soon as possible after an injury before a lethal dose of toxin is produced in the wound, which may be as soon as 6 hours after injury. So within 6 hours, we should start with antibiotics and tetanus toxoid should be given. Then prevention of neonatal tetanus. Neonatal tetanus is well controlled in some industrialized countries through the clean delivery practices alone. Over the last decade, most programs in developing countries have concentrated on training the traditional birth attendants, providing home delivery kits, and educating pregnant women about the 3 cleans, that is clean hands, clean delivery surfaces, and clean cord care. That is clean blade for cutting the cord, clean tie for the cord, and no application on the cord stump. What are 3 cleans? Clean hands, clean delivery surfaces, and clean cord care. Then operational research has shown that training of birth attendants alone can reduce the death due to neonatal tetanus by 90%. This tetanus toxoid will protect both mother and her child. In unimmunized pregnant women, 2 doses of tetanus toxoid should be given. The first as early as possible during pregnancy, and the second at least a month later and at least 3 weeks before delivery. So according to the national immunization schedule, these doses may be given between 16 to 36 weeks of pregnancy, allowing an interval of 1 to 2 months between 2 doses. In previously immunized pregnant women, a booster dose is sufficient. The infants born to the mothers who have not previously received 2 doses of tetanus toxoid are exposed to the risk of neonatal tetanus. They can be protected by the injection of antitoxins if it is administered within 6 hours of birth. So tetanus is a vaccine preventable disease. Do vaccinate without fail. Tetanus is a vaccine preventable disease. Do vaccinate without fail. Any doubt? If any doubt, you can call me or message me personally. The PPT and video will be provided. You can directly watch it on YouTube. Thank you. You can leave the meeting.